Hi everybody, my name is Vanessa Velasco. This is my case study 1 project presentation for this course. This is my client H. He is 5 years old with a diagnosis of autism spectrum disorder, or ASD for short. Behaviors that are of concern are aggression and tantrums. For communication, he is verbal and vocal, but still presents deficits in his language and communication. I've been working with this little guy for almost 1 year now, but he's been with my company for close to 3 years. He loves washers, dryers, big fans, and Donald Duck. These are his barrier to learning behaviors. Through indirect assessment and direct assessment, functions of the following behaviors have been determined. Indirect meaning interviews and questionnaires for the family and other shareholders. Direct meaning observations, ABC data collection, and more. So his aggression is defined as any behavior that causes or intends to cause physical harm to another person. This includes, but is not limited to, hitting, kicking, scratching, or using objects to inflict harm. Non-examples include bumping into someone in a crowded space, tossing a ball at a pier. The function determined is access to tangible items and attention. Tantrums are any instance of crying, throwing oneself to the floor, whining, screaming, straining body so he can't sit down that last longer than 2 minutes. Examples include collapsing to the ground, accompanied by refusal to stand or more, crying in loud vocalizations with tears, screaming with high pitch. Non-examples include in response to injury, low volume crying without accompanying disruptive behaviors. The functions of tantrum are escape and access to tangible items, as well as attention. So the assessment selected is the Verbal Behavior Milestones Assessment and Placement Program, or VBMAP for short. This is a valuable tool in ABA for assessing and supporting the development of young children with ASD or other developmental disabilities. This provides a detailed evaluation of verbal behavior and related skills. It helps practitioners create effective, individualized intervention plans that promote meaningful progress and enhance the child's overall development. This assessment was specifically chosen because parents wanted to update the treatment plan and the programming to match emerging skills that their child was exhibiting. This assessment will aid to kind of guide with new details for the said plan, in addition to identifying barriers to target so learning can be maximized. And essentially, there are 3 portions: the milestone assessment, barriers assessment, and lastly, the transition assessment. But we'll go over each section and what they entail with the results for my client. So we'll go over the results. The milestone assessment. This portion is intended to assess the child's existing verbal and related skills. It's formatted with 170 various milestones across 16 various domains. Domain examples are including manding, tacting, listener skills, and play skills. The age range of these milestones is 0 to 48 months. So the outcomes of this assessment is to gain a better understanding of where our buddy's skill deficits lie, to kind of restructure the programming to best fit and build his repertoire. So based on these results, my client exhibits major deficits across multiple categories for what is age appropriate. Examples to highlight are his social skills, most portions of the level 3, half of level 2. But in terms of his score for level 1, he scored 43 points, and this age range is 0 to 18 months. For level 2, he scored 38.5 points. The age range for this is 18 to 30 months. For level 3, he scored 11 points. For the age range of level 3, it's 30 to 48 months, for the total score being 92.5 out of 170. So for the barriers assessment, this portion of the assessment is mainly to identify any obstacles that may impede skill acquisition and effective learning. So this includes 24 potential barriers, such as prompt dependency, scrolling, self-stimulatory behavior. The outcome of this section is to help in the development of strategies to overcome these barriers. So, barriers that my client's displaying are problem behavior, deficits in social skills, work motivators is really difficult for him, obsessive compulsive behavior, and more. He scored a total of 48 points for this assessment. Transition assessment. This portion allows to evaluate the readiness of less restrictive educational settings. This consists of 18 areas that assess the child's ability to learn in a group, participate in social interactions, adapt to changes in routines. The overall outcome of this portion is to help guide the decision on transitioning to mainstream classroom or other environments. So examples of interpretation of these scores is that my guy scored a 1 on negative behaviors and instructional control section. A placement in a less restrictive classroom may be difficult, unsafe, and unproductive. A child who demonstrates this level on negative behaviors would benefit from a carefully designed BIP or behavioral intervention program that is implemented by trained classroom staff in a setting where they can kind of focus on the reduction of these behaviors. These are the references for my presentation, and thank you.